Hi, I'm Dr. Chad Larson. When I have a young adult on my schedule, I can almost predict what they're coming in for. And what I seem to find and what seems to work clinically was just recently validated in a published study. So I wanted to share those results with you and also talk about how that kind of reflects what I'm seeing in clinical practice. So it's very common between ages, young adults between 18 and 25. If I see them on the schedule, I can almost predict that they're coming in with anxiety, depression, and symptoms that kind of go along with that. And what I'm finding is that there's some problems with their diet and lifestyle. Some pretty basic things that were just validated in a study, actually, that was just published a few days ago in a medical journal called Frontiers in Psychology. And this was an international study. It looked at students between the age of 18 and 25 in the US and New Zealand. And they looked at over 1,100 students in that age group. And what they found out is they did a whole line of different questioning and surveys and some evaluations on a couple things. One is they evaluated sleep quantity and quality. They looked at exercise and they looked at diet. And they came up with some pretty clear statistics about what leads to mental health and wellness. They're specifically looking at mental health and wellness, not really any other parameter. So what does it take to maintain health? And on the flip side, what activities are a greater risk for developing depression? So there's three main pillars that they looked at. The one pillar that was certainly significantly helpful was exercise. Okay, so we'll say this is exercise. So that particular pillar was definitely important to help mitigate depression, and also those who had a greater amount of exercise, 30 minutes a day, more days than not, had a significant increase in mental wellness. The other key thing was diet. And particularly what they whittled diet down to was fruits and vegetables. Out of all the different dietary factors that they evaluated, the quantity of fruits and vegetables, it came down to 4.8. So let's call it about 5 servings of fruits and vegetables a day. Those who had, on average, 5 servings of fruits and vegetables per day had a significant decrease in depressive symptoms and an increase in mental well-being. And particularly within the category fruits and vegetables, it was raw fruits and vegetables. So that had a significant improvement on mental well-being. But by far, the thing that had the most impact on wellness, mental wellness, and lack of sort of decreasing the risk factors of depression was by far sleep. They looked at both quantity and quality of sleep, and it showed that quality of sleep was even more important than quantity. And basically the way that they generally evaluated quality was, how do you feel when you first wake up in the morning? How you feel in the morning could really dictate the quality of the sleep from the night before. Quantity obviously was, how many hours they slept. And on average, between 8 and 9.7 hours was what is shown to be the key kind of time frame in this age group between 18 and 25. So what these are the 3 main pillars of mental well-being, and to help to mitigate these symptoms of anxiety, depression, these kind of things. And this is exactly what I've seen clinically. It's very common, I'm seeing in this age group, in the age of COVID, where the schedules of our young adults are just completely thrown off. They don't have the normal sports they would typically have. They're at home more. Their diets seem to be kind of falling off. They're their screen time has just, I don't know, quadrupled, if not more. And a lot of screen time and video game playing is going into the night and even the early morning hours. And the whole circadian rhythm is just really thrown off. Diets are kind of falling apart. Exercise is kind of falling apart. This is just kind of a generalization, but the ones that tend to end up on my schedule, these are the factors that I've seen over and over again. And if we can just come back to these foundational pillars, it could really help to massively and significantly reduce symptoms of anxiety, depression. And so now it's been validated in the study that was just published a few days ago. So these are the 3 pillars: diet, sleep, and exercise. And by far, sleep is the key. So really, really make sure that you're following kind of a normal sleep pattern. Going to bed between 9 and 11, and then making sure that you're sleeping for 8 to 9.7 hours is what the study showed. And young adults typically need a little bit more sleep than older adults, but these same things really actually apply to older adults as well. This particular study was on young adults. Older adults maybe require a little bit less sleep. Data that I've read has been between like 7 and 9 hours. And so for young adults, it's a little bit more, about 8 to 9.7 hours. So that seems to be the key thing. When that was reported, the mental health and wellness was significantly better. And for every time period below that kind of average optimal time, that depression gets greater and greater and greater, the lower the quantity and the quality of the sleep is. So a few key things. If you're not a young adult and you're reading this or hearing this, then please make sure that some young adult that you can explain this to, and really make sure, because I'm really concerned about the health and wellness of our young adults right now, especially their mental health. And this is a recent study that really shows some very, very clear, I think, pretty simple things that we can do. Follow these 3 pillars, and that'll put you and your loved ones on a better track to mental health and wellness. So hopefully that's helpful. I will keep reading the studies and bringing you the information. Until then, keep it real.